South Africa actually complies with standards and recommended practices from the International Civil Aviation Organization, which is a UN agency. And that agency, together with WHO, have actually issued a joint statement indicating that the risk of transmission on board an aircraft is actually low. Therefore, based on that, and based on the reports up to now, there is no evidence that the risk on board an aircraft, including measures that we have, that the risk of transmission on board an aircraft is actually high. So based on that, I would actually say the risk is low.
I want to talk about what processes have been put in place, first of all, starting with the airlines.
Okay. South African Civil Aviation Authority comply with the International Civil Aviation Organization. Therefore, we have to have regulations in place. These regulations actually were developed since 2009 to deal with public health events of international concern, Ebola being one of them. So our focus has not been only on Ebola, but it has been on any public health event of international concern. So we have regulations at the Civil Aviation Authority. We are audited on that, and airlines and airports and air traffic navigation system have to actually comply with our regulations. That's a starting point. So there is legislation that looks at this issue particularly. Airlines are actually required to actually train cabin crew on identifying suspected cases of communicable diseases. Once they do, on board an aircraft, we have universal precaution kits, we have doctor's bag, and we have first aid kits. We have a procedure in place for them to call the doctor on board, a nurse, or a paramedic. If they are not available, then they will proceed to actually manage the case. How they manage the case is that we allocate a specific cabin crew to make sure that it doesn't spread. If there's space on board an aircraft, they relocate the passenger to a more available space away from other passengers. They will allocate a specific bathroom toilet to make sure that you don't actually spread or expose other passengers. They will actually inform the pilot in command immediately, who will inform air traffic controller, who will then activate all the systems at the airport to make sure that when that aircraft lands, everybody knows what they're supposed to do, starting with the ambulance. Obviously, the designated ambulance have to be there with protective equipment to actually fetch the passenger, one.
But Dr. Bogatsu, I just want to get to one particular aspect. Looking at the much publicized Liberian man who was detected in the United States, questions are being asked about how effective these screening procedures are.
It depends. Remember, the incubation period of Ebola is 2 to 21 days. So that particular deceased Liberian, it depends on whether he was actually symptomatic while he was actually flying or not. So if he was not symptomatic, obviously he wouldn't be detected, number one. Even if the screening tools were there, and I'm not sure what Americans actually had in place at the time.
Yes.
If he was not symptomatic, whether you actually had thermal scanners or you had questionnaires, they wouldn't have been detected because he wouldn't have been symptomatic. So it depends on the stage of the disease that you had.
But that seems to be a loophole then. Is that cause for concern?
It's not a loophole per se. It's really it depends. The screening measures that are actually put in place that are available at the moment, there is no specific sensitive and specific screening tool that will be able to detect 100%. So we do have screening measures, and that's actually a space that we at the Civil Aviation Authority don't look after. It's the National Department of Health that actually looks after that. But from my experience, from the presentations that I've actually attended, is that we may have screening measures in place. It depends on the incubation period. If it's short, it's actually good because it will be able to be picked up. But remember, passengers also can decide, if I want to actually get to a country, I can actually take Panado. I can lie on a questionnaire. So screening measures are there. However, they also have their shortcomings.
These screening facilities, do you think they're adequate at these airports, the ones, of course, that you can speak on behalf of?
You mean in South Africa?
That's correct.
As I've indicated, Chriselda, the screening measures that are in South African airports are actually the responsibility of the National Department of Health. Currently, there are thermal scanners at OR Tambo and Lanseria, and there are questionnaires that are actually in place. Other places actually use visual screening, which is a very effective measure. Our cabin crew, for example, would actually continuously be using visual screening as we are handling passengers. So one of the cheapest method that we actually advocate is this visual screening, because it's actually easier to detect. And even baggage handlers, for example, those people who are used at check-in points when you're actually about to check in your bags, can actually look at you and they have symptoms in front of you. And if there is something that they're not happy with, they may call a supervisor. And if they're not happy, then they will deny you boarding the aircraft. There
have been a series of conferences to address the issue of this epidemic, but what is the aviation industry's participation been in this?
Actually, Chriselda, the aviation industry takes this issue very seriously. Following the SARS outbreak in 2003, it was established that it was the aviation sector that actually suffered majorly in terms of air travel. There was a major reduction in air travel in Hong Kong. And that meant that there was it has a huge financial impact to the financial industry. Hence, the International Civil Aviation Organization, together with WHO, developed the program in 2009. So since 2009, the first meeting in Africa regarding this particular matter took place in Gabon in 2007, and then the second meeting was in Nigeria in 2009, and South Africa actually hosted the meeting to address this particular matter in 2009 in October. So we were one of the first countries that actually invited the international community, Center for Disease Control, WHO, ICAO, to say, here are your standards. Can you come and evaluate if we actually understand what they are, and are we implementing them according to your standards?